Cancer recurrence is a term that evokes significant anxiety for patients and their families. It refers to the return of cancer after a period during which it was undetectable or in remission. Understanding why cancer recurs, how it can be detected early, and what treatment options are available is crucial for both patients and healthcare providers. This comprehensive discussion explores the multifaceted causes of cancer recurrence, the biological mechanisms behind it, risk factors, patterns of recurrence, methods of detection, and the evolving landscape of treatment strategies. The journey through cancer diagnosis and initial treatment is often arduous, involving surgery, chemotherapy, radiation, targeted therapies, or a combination of these. When a patient completes treatment and enters remission, there is hope for a cancer-free future. However, even after the most aggressive and thorough treatments, cancer can return. This phenomenon is rooted in the complex biology of cancer itself. Cancer is not a single disease, but rather a collection of diseases characterized by uncontrolled cell growth due to genetic mutations. These mutations can give rise to cells that are highly adaptable and capable of evading the body's defenses and medical interventions. One of the primary causes of cancer recurrence is the presence of residual cancer cells that survive initial treatment. These cells may remain dormant or undetectable for months or years before reactivating and proliferating. The reasons for their survival are varied. Some cancer cells may possess inherent resistance to chemotherapy or radiation, owing to genetic mutations that render them less susceptible to these agents. Others may evade detection by hiding in areas of the body that are less accessible to treatment, such as the brain, bone marrow, or lymphatic system. Additionally, the microenvironment around the tumor, comprising blood vessels, immune cells, and connective tissue, can provide a protective niche that shields cancer cells from therapeutic assault. Another important factor in cancer recurrence is the concept of minimal residual disease, MRD. MRD refers to the small number of cancer cells that remain in the body after treatment and are below the threshold of detection by conventional imaging or laboratory tests. Advances in molecular diagnostics have improved the ability to detect MRD, but these cells can still persist and eventually lead to relapse. The genetic diversity within a tumor, known as tumor heterogeneity, further complicates treatment. A single tumor may contain multiple subclones of cancer cells with distinct genetic profiles, some of which may be more resistant to therapy than others. As treatment eliminates the more sensitive cells, resistant clones can survive and drive recurrence. The immune system plays a dual role in cancer recurrence. On one hand, it can recognize and destroy cancer cells. On the other hand, cancer can develop mechanisms to evade immune surveillance. For instance, some cancer cells express proteins that inhibit immune cell activity or recruit regulatory cells that suppress the immune response. Immunotherapy, which aims to harness the power of the immune system to fight cancer, has shown promise in preventing recurrence in certain cancers. However, not all patients respond to immunotherapy, and some tumors develop resistance over time. Lifestyle factors and patient-specific characteristics also influence the risk of recurrence. Factors such as age, overall health, genetic predisposition, and the presence of comorbid conditions can impact the likelihood of cancer returning. For example, individuals with inherited mutations in genes, such as BRCA1 or BRCA2, are at higher risk for recurrent breast and ovarian cancers. Likewise, lifestyle choices, including diet, physical activity, tobacco, and alcohol use, can affect recurrence risk. Obesity and chronic inflammation have been linked to higher rates of recurrence in several cancer types. The pattern of cancer recurrence can vary depending on the type of cancer, stage at diagnosis, and initial treatment received. Recurrence may be classified as local, regional, or distant. Local recurrence refers to cancer returning at or near the original site, while regional recurrence involves nearby lymph nodes or tissues. Distant recurrence, also known as metastatic recurrence, occurs when cancer spreads to organs or tissues far from the original tumor. The likelihood and timing of each type of recurrence differ among cancers. For example, breast cancer commonly recurs in the bones, liver, lungs, or brain, whereas colorectal cancer tends to recur in the liver or lungs. Detecting cancer recurrence early is vital for improving outcomes. Regular follow-up visits, imaging studies, and laboratory tests are standard components of post-treatment surveillance. The choice of surveillance strategy depends on the type of cancer, risk of recurrence, and available resources. For some cancers, blood tests that measure tumor markers, substances produced by cancer cells, can provide early warning signs of recurrence. Imaging modalities such as computed tomography, CT, magnetic resonance imaging, MRI, positron emission tomography, PET, and ultrasound are used to monitor for new growths. In recent years, liquid biopsies, which analyze circulating tumor DNA, ctDNA, in the blood, have emerged as a promising tool for detecting recurrence before it becomes clinically apparent. When cancer does recur, the treatment approach depends on several factors: the location and extent of recurrence, the time elapsed since initial treatment, the patient's overall health and preferences, and the biological characteristics of the recurrent tumor. In some cases, the recurrent cancer may be amenable to curative treatment, such as surgery or localized radiation. In other cases, especially with distant metastases, the focus may shift to controlling the disease, prolonging survival, and maintaining quality of life. Surgical intervention remains a cornerstone of treatment for localized recurrences, provided the tumor can be completely removed and the patient is a suitable candidate for surgery. Advances in surgical techniques, including minimally invasive approaches and image-guided procedures, have improved outcomes and reduced recovery times. Radiation therapy, either alone or in combination with surgery, is another option for targeting localized recurrences. Stereotactic radiosurgery and intensity-modulated radiation therapy, IMRT, allow for precise delivery of high-dose radiation to tumors while sparing surrounding healthy tissue. Systemic therapies are essential for treating regional or distant recurrences. Chemotherapy, once the mainstay of systemic treatment, is now often combined with or replaced by newer modalities. Targeted therapies, which specifically inhibit molecules involved in cancer growth and progression, have transformed the management of certain cancers. Examples include tyrosine kinase inhibitors for chronic myeloid leukemia and HER2 targeted agents for HER2-positive breast cancer. These drugs are often more effective and less toxic than traditional chemotherapy, but resistance can develop, necessitating ongoing research and development of new agents. Immunotherapy has revolutionized the treatment of some recurrent cancers, particularly melanoma, lung cancer, and certain types of lymphoma. Immune checkpoint inhibitors, such as those targeting PD-1, PD-L1, or CTLA-4, have produced durable remissions in a subset of patients. However, not all tumors are susceptible to immunotherapy, and researchers are working to identify biomarkers that predict response. Combination therapies, which pair immunotherapy with chemotherapy, targeted agents, or radiation, are being explored to overcome resistance and improve outcomes. Hormonal therapies remain important in the management of hormone-sensitive cancers, such as breast and prostate cancer. In these cases, recurrence may be driven by the continued presence of hormones that fuel cancer growth. Drugs that block hormone production or action, such as aromatase inhibitors or androgen receptor antagonists, can delay or prevent recurrence. Resistance to hormonal therapy is a significant challenge, prompting investigation into novel agents and combination strategies. Clinical trials play a critical role in advancing the treatment of recurrent cancer. Participation in trials gives patients access to cutting-edge therapies and contributes to the collective understanding of cancer biology and treatment. Trials may test new drugs, combinations of existing therapies, novel delivery methods, or innovative approaches such as personalized vaccines or adoptive cell transfer. Genomic profiling of recurrent tumors is increasingly used to guide therapy selection and match patients with targeted treatments. Supportive care is an integral part of managing cancer recurrence. The physical and emotional toll of recurrence can be profound, affecting not only the patient but also their loved ones. Palliative care, which focuses on symptom management and quality of life, should be integrated early in the course of recurrent disease. Addressing pain, fatigue, nutritional needs, psychological distress, and social concerns is essential for holistic care. Support groups, counseling, and survivorship programs provide valuable resources for coping with the challenges of recurrence. Preventing recurrence is a major goal of cancer care. While not all recurrences can be prevented, several strategies can reduce risk. Adherence to prescribed therapies, including completion of adjuvant treatments such as chemotherapy, radiation, or hormonal therapy, is critical. Lifestyle modifications, such as maintaining a healthy weight, engaging in regular physical activity, eating a balanced diet rich in fruits and vegetables, limiting alcohol consumption, and avoiding tobacco, have been associated with lower recurrence rates in some cancers. Vaccination against cancer-causing viruses, such as human papillomavirus, HPV, and hepatitis B virus, can prevent certain types of cancer from developing or recurring. The psychological impact of cancer recurrence cannot be underestimated. The fear of recurrence is a common and persistent concern among survivors. This fear can affect mental health, relationships, and daily functioning. Open communication with healthcare providers, realistic discussions about prognosis and treatment options, and access to mental health support are vital components of survivorship care. Mindfulness-based interventions, cognitive behavioral therapy, and stress reduction techniques have been shown to help manage anxiety and improve well-being. Research into the mechanisms of cancer recurrence is ongoing and rapidly evolving. Scientists are exploring the role of cancer stem cells, cells within a tumor that possess the ability to self-renew and give rise to new cancer cells, in driving recurrence and resistance. The tumor microenvironment, including interactions between cancer cells and surrounding stromal, immune, and vascular cells, is another area of intense investigation. Understanding these complex relationships may lead to novel therapeutic targets and strategies to prevent or delay recurrence. Liquid biopsies and other advanced diagnostic tools are poised to transform the monitoring and management of recurrence. By detecting genetic alterations and molecular signatures associated with residual or recurrent disease, these technologies offer the potential for earlier intervention and more personalized treatment. Artificial intelligence and machine learning are being applied to large data sets to identify patterns and predictors of recurrence, aiding clinicians in risk stratification and decision-making. The landscape of cancer treatment is shifting toward precision medicine, in which therapies are tailored to the individual characteristics of each patient and their tumor. This approach holds promise for improving outcomes in recurrent cancer by matching patients with the most effective treatments based on genetic, molecular, and clinical data. The integration of multidisciplinary care teams, including oncologists, surgeons, radiologists, pathologists, genetic counselors, and supportive care specialists, ensures that patients receive comprehensive, coordinated care throughout their cancer journey. Despite advances, challenges remain in the management of cancer recurrence. Drug resistance, toxicity, financial burden, and disparities in access to care are significant obstacles. Efforts to address these issues include the development of less toxic therapies, strategies to overcome resistance, policies to improve affordability and access, and initiatives to reduce disparities among different populations. In summary, cancer recurrence is a complex and multifactorial process influenced by the biology of the tumor, the host environment, treatment factors, and lifestyle choices. Understanding the causes of recurrence and the mechanisms by which cancer cells evade eradication is essential for developing effective prevention and treatment strategies. Early detection through vigilant surveillance and advances in diagnostic technologies can improve the chances of successful intervention. Treatment of recurrent cancer requires a personalized, multimodal approach that incorporates surgery, radiation, systemic therapies, and supportive care. Ongoing research, clinical trials, and the integration of precision medicine are paving the way for better outcomes and improved quality of life for patients facing recurrence. Empowering patients with knowledge, fostering open communication, and providing holistic support are key elements in navigating the challenges of cancer recurrence and moving toward a future where recurrences are fewer and more manageable.